Personality disorders. Personality disorders include inflexible and maladaptive behavior patterns that may impair functioning and relationship. So, in personality disorders, the person may be like normal in almost all the activities, but he will have a certain type of behavior patterns which will damage his relationship or which will impair functioning. Most of the time, because of this behavior pattern or because of this personality, the patient suffers or others have to suffer. Sometimes patient have to suffer, or sometimes patient family, wife or relatives or friends, they will suffer because of his attitude or his behavior patterns. So what will happen? Because of these personality disorders, sometimes people will hate him, or he cannot maintain proper relationship with the patient. So that is what personality disorder. So in personality disorder, it is inflexible. The patient will be inflexible, and there will be some type of maladaptive behavior patterns. That is the problem. But in other case, if you check his judgment, insight, or all other things will be normal. He will be like a normal person, but he will have some certain personality traits which is which we can call maladaptive, or we can call which is not suitable, and because of that the other people sometimes suffer, or sometimes patient himself suffer. Let's see some of the different personality disorder. The first one is paranoid personality disorder, then schizoid or schizotypal personality disorder, dissocial personality disorder, impulsive and borderline type personality disorder, then histrionic personality disorder, then anarchistic or obsessive compulsive personality disorder, anxious personality disorder, dependent personality disorder, other disorders. Let's see each of these disorder in detail. The first one is paranoid personality disorder. As the name indicate, paranoid, the person will have doubt. He will doubt everyone. He will doubt his friends, his relationships, and everything. He will doubt. That is his problem. Paranoid. He will be suspicious, mistrustful. Always he will be argumentative, then stubborn, then self-important. He will always think about himself, and he is suspicious or mistrustful. This is the main point. Suspicious. He will doubt everyone. That is paranoid personality disorder. From the name itself, we can understand paranoid means doubting everyone. Then schizoid personality disorder. These people will be emotionally cold, aloof. They are aloof. The main point is aloof. Schizoid. Whenever you hear schizoid personality, these people are emotionally cold. Sometimes you will feel that they don't have any type of feeling. They don't have any type of attachment to anyone. Sometimes to parents, some to wife, or sometimes to children or friends. They won't have any feelings. They are like we can say emotionally cold and detached, humorless. They will not smile. Then introspective, they are always want to sit alone, always thinking about their own things. They are not interested to interact with others, or they are not interested to involve in others activity. They are always like to be introspective. Then so that is called a schizoid. The other one is schizotypal disorder. These type of people, they will have inappropriate affect. The main thing is odd belief and magical thinking. They always tell about some things, and when we hear that about that thing, we cannot see any logic. Without any logic, without any base, they will tell or think a lot of things. We can call it as magical thinking. They are in a magical world, and they will tell things, or they will tell you some concept or idea, whatever it is. There will not be any logic. That is called magical thinking. So these type of people we can call schizotypal. They are socially withdrawal because of their this type of magical thinking. And then odd and eccentric or peculiar behavior. We can see a type of eccentric. These people will be eccentric. The way they talk, their way they think, we can say eccentric. Okay. It's the main thing is magical thinking. That is schizotype. Then antisocial or dissocial personality disorder. Sometimes we can say sociopath or psychopath. As the name indicate, antisocial. Antisocial means they are like a violent people. They cannot maintain relationship. They are not thinking about others' feelings. They sometimes beat others. They sometimes do harmful things to others, and yet they won't have any feelings. They will not have any guilty feeling or a regret. They will not regret. They are not thinking about others' feelings. They will have impulsive actions, frustrated. They will do violence, lack of guilt. So these two people are antisocial. We can call antisocial or sociopath or psychopath because they will do bad things. They will sometimes attack, or easily they will get irritated and they will do violent behavior. That is called antisocial. From the name, it's you can easily understand what is antisocial. the the next one is histrionic personality disorder. Mainly this disorder is seen in female, common in females. These people will be dramatic. They are specialized in dramatic emotionality. They will show a lot of dramas or dramatic emotionality, you can see, like when they will get angry. When they are when they are angry, they will show a lot of reactions than the normal thing. When they will get some happiness, or if they are happy, they will laugh, or they will, we can say they are attention seeking behavior. For a small humor or for a small joke, they will laugh like anything. When they get any trouble or any bad feelings or anything, when they are sad, they will cry like anything. Like we can say they will do lot of drama, or emotionally they will do lot of drama. You can see emotional blackmail. Then they will sometime, when they get some type of problems, they will do some suicide attempts. So then they always attention seek, they're having always attention seeking behavior, and they are concerned about physical attractiveness. If you see these people, the way they dress, the way they do the makeup, everything will be somewhat, we can say, over or more, or you will have, because they will do everything more to get more attractiveness. They are attention seeking behavior. So whatever the things they do, they will, we can say, they will do more. Like if they cry, they will cry like anything. If they laugh, they will laugh like anything. And whatever, if they dress, they will do something attractive, or they somehow they want to attract others. That is attention seeking behavior. That is histrionic personality disorder. The main problem, these people, they are dramatic. When they get emotions, they will show a lot of dramatic scenes, like emotionally blackmailing. They will, for a small things, they will tell, they will go for suicide attempt, etc. That is called histrionic personality disorder. Narcissistic personality disorder means they are always giving self importance. They think that they are the best, or they are giving always self importance. They will not hear or obey others words. They are also attention seeking. They are also having dramatic behavior. They cannot face criticism. If somebody criticizes them, or if somebody judge them, they won't like, or they cannot face that. They do not have any empathy. They always want to do, or they are always thinking about their things or their matter. For their benefit, they will do anything. They will exploit others. Sometimes they will not look whether it is a friend or any other one. For their reason, for their victory, we can say victory, or for their success, they will do anything. That is narcissistic personality disorder. And they give self importance. They give self importance. From the word you can see narcissism or narcissistic. We can compare this like Hitler. So this is this type of personality disorders people, giving more self important, and they are attention seeking. That is the two important things. Then borderline personality. In this borderline personality people, they cannot maintain proper relationship. Their mood will be different, and a lack of control on anger, because as the word indicate borderline, you cannot say at what time they will change their mood. They will have different type of mood. Then they will have recurrent suicidal threats or behavior. Then sometime their personality also change almost all the time. And this is borderline personality. Then avoidant personality disorder or anxious personality disorder. These people always they are in tension, sometimes without any reason, or for a small things, or for they will get more tension for small matter also. For doing a small things, they will get more tension, and sometimes without any problem they will have tension. Then they always have an inferiority complex. They fear criticism. If somebody criticize them, they fear that. And they cannot involve with other people. They always think about thinking that these people are always thinking that that other people are will not accept me, or they always thinking that like this other people are rejecting me. Always these people will have a negative thought all the time. So these people always in a preoccupation with being criticized or rejected in social situation. They are thinking that okay, maybe it is not happening, but yet if they are going for a function, before reaching that area, they are thinking that these people will not accept me, they will reject me, they will not talk properly with me, they don't want to have a relationship with me. They are thinking like that. Actually it is not happening, but before reaching that area they are thinking. They always think that other people are not um, uh, interested on me, they always telling bad about me. So this type of thinking they are having, and they always have tension. They are having tension. That is the personality anxious. The dependent personality people, they are always dependent. They want to they will not do anything alone. Like they always want somebody to guide them or somebody to order. They will not if even though they have some their own idea, their own interest or needs, they will not tell that thing. They will always subordinate their own needs, which means that they will keep their needs or interest everything down. They always obey others. uh, they will not demand anything. If any in any situation, even though they have any demands or any needs, if they want something, they will not tell, they will always obey. That is dependent personality. They cannot take decision, they always obey others decision. Then if they are alone, they feel uncomfortable or helpless. They always need somebody to guide them. So if they are alone, they feel uncomfortable. From the word itself you can understand dependent personality. Then obsessive compulsive or anarchistic personality disorder. Obsessive compulsive personality disorder, they always have always caution. They will be always careful. They always tell about details, rules, list, order, schedule. They want everything in a perfect manner. If it is changed, if any change happening in their life or routine life, they will have tension, lot of problem. They want perfectionism. If they see their room change, if anything changed in their room, it will cause problem. They will shout with others, and they don't like to be with others if because of this problem. The other people also hate him because he's this type he's this personality. And they are always rigid, stubborn, and high standard. Everything he needs a high standard. He will not be satisfied. It's very difficult to satisfy him. If whatever he do, he wants to do it in perfect way. So other people he will hate him. That is obsessive compulsive personality disorder. So treatment for this personality disorder, actually there is no need of medicine or something. Uh, by doing some counseling or therapy, psychotherapy, there will be difference in these problems. The first one, individual and group psychotherapy, therapeutic community. We can put like we can provide them a therapeutic community so that it will help them to change. Then behavioral therapy, manipulation of the social environment. These are the some of them treatment. And the nursing management, when it comes to nursing management, mainly we have to uh, uh, understand the patient on a one-to-one basis. And those people, they are having suicidal attempts or so, like histrionic personality disorder, those who are having suicidal tendency, we have to deal with them separately by making a contract, by talking with them properly, and never and ever like judge them or criticize them. Talk with them and make a good relationship with the patient. Then you have to work on the patient for the change of the patient. So these are the some of the personality disorders. Normally personality disorders, no need to take medicine or something, and it's very easy to understand from the word itself. You can understand what type of personality, like if it is histrionic personality, we know that the person will show a lot of emotions. They are attention seeking behavior. From narcissistic personal disorder, we know that this person is like Hitler. He wants to he gives more self importance, etc. So most of the time the questions are not coming from this part. Only just understand the concept, so that if any questions coming from this part, you can easily answer questions from this. Thank you.